When 18-year-old Precious tested positive for HIV, she thought life would never be the same.
I felt so devastated. I felt so angry with myself. I felt like my dreams are not going to come true. I felt like I was not going to be the doctor I wanted to be. I was not going to do so many things I wanted to do.
But Precious is not the only one who felt this way when they found out about their HIV status.
I now fainted. I did not know what happened. After 1 week, I recovered myself. My thought was, so I am no more going to stay long like that. So my life is now short. So
my people, my parents, everybody was all against me. I was like, it's better I even kill me and my son, at least go out of this world.
When I thought of my children, if I die today, how would my children cope? And maybe they would die or something like that.
But the fears of Precious, Amarachi, Celestina, Lami, Kelechi, and thousands more all vanished when they got a new lease on life through a timely and effective intervention from the U.S. Center for Disease Control and Prevention, CDC, Nigeria, and Catholic Caritas Foundation of Nigeria, also known as Caritas Nigeria.
Our organization is Catholic Caritas Foundation of Nigeria, and we have a very ambitious vision of a society where all persons, all human beings made in the image and likeness of God should have the opportunity of a fullness of life. The ambition is done through our various interventions in the health sector, in the humanitarian sector, in the good governance sector, and in all other interventions in our organization.
One of the major thematic area is health, and to see how to provide, to help people to live the good quality of life, health-wise and spiritually as well.
With a shared vision of ending AIDS by 2030, CDC and Caritas Nigeria began a partnership aimed at building sustainable and high-impact national HIV response programs that accelerate HIV epidemic control, also fulfilling the mandate of Caritas to be the outreach of the church to those in need. This partnership has led to the completion of 2 projects in about 10 years, the Sustain and the 4GATES projects.
The 4GATES project stands for Global Action Towards HIV Epidemic Control in Subnational Units in Nigeria. The 4 there symbolizes we were 4 partners that came together to submit that application with Caritas Nigeria as the prime partner. The 4GATES project is a comprehensive HIV prevention care and treatment project that was implemented from 2017 up until September 2022. And we were allocated 4 states in the southeast Nigeria and south Nigeria to implement the project.
4GATES is a project that is implemented by Catholic Caritas Foundation of Nigeria, and of course is a 5-year fund that we got from the US CDC PEPFAR, and Caritas being one of the implementing partners in Nigeria, is solely to intervene to look out for unmet needs, the people that are living with HIV but have not been identified. And so that was the reason why CDC contracted Caritas Nigeria to be able to do that. And this we have been able to do over the 5 years.
Our main mandate on the 4GATES project was achieving epidemic control within the states of Delta, Enugu, Imo, and Abia. Now, to do this, CDC came up with a strategy called the SWORD strategy, which is intensified case finding. At high levels, our main push was engaging with the state partners at the highest level. So the Deputy Chief of Missions of the US Embassy was involved in a surge launch with the governors of the state to help promote state ownership and sustainability. And then we set up an incident command structure within the states to drive the process.
There was a survey that was done in 2018 called the NICE survey. And based on the figures from the NICE survey, the national prevalence for HIV/AIDS was 1.4%.
All states that have prevalence above the national average were classified as priority state for implementation. 3 of our 4 states, namely Delta, Imo, and Enugu states, became priority state of intervention, where accelerated activities towards pushing the states to epidemic control was initiated, and that was informed the SURGE program.
Of course, that led to a speedy intervention in Enugu State, where we needed to work differently from the way we used to work. Of course, bringing in the stakeholders, the host government, the government of Enugu State, and different other stakeholders to be able to ensure that in terms of the prevalence, we reduce it and ensure we even go below what the national prevalence is. We started doing that, bringing different interventions and strategies.
In terms of our key strategies, we were screening people for HIV. Usually we'll do it mainly in the facilities, but this time we went into the communities. We also engaged with other health facilities that were not supported by the program, which we would call spokes, primary health centers, private clinics, provided them with test kits in some instances to test people, and wherever they found a positive, also facilitated their referral of those cases to our facilities for registration. We also worked with community-based organizations to help test within the communities. And then one other strategy that was key, especially in Delta State, was working with key population community-based organizations.
The special strategy we used was for us to strengthen the CBOs, build their capacities, and also we also used the system strengthening as well to work with our stakeholders. We were very, very close with the Ministry of Health, Ministry of Education, Ministry of Women Affairs, and even the stakeholders in the community. So we used the community system, the Child Protection Network, and other community stakeholders like community leaders in the various communities where we are implementing. We worked with them to ensure that they are carried along and to help to strengthen our services and our service delivery across the LGAs where we worked.
They built our capacity substantially, I must acknowledge. They supported every bit of activity ranging from drug pickups, because they were even giving us support or intervention for them to ensure adherence. We also tried to do emergency health support whenever they are sick. It was our business. We will, inform Caritas, and they will always oblige us, give approvals for us to pay their hospital bills. So that honestly minimized the rate of death. We were also doing food transfers, because sometimes they will tell you when you reach them that they can't take their drugs because they don't have anything to eat. So in such cases, we are sending, emergency food support to make sure that they eat and now take drugs to be held.
We've recorded so many successes with Caritas and 4GATES program, beginning from staff attrition. We don't have staff attrition in all the facilities that they support. And again, the refurbishment they did in some of the facilities, good one. Kudos to Caritas and 4GATES. The logistic challenges are no longer there. Before, we had the occasional stockers with test kits and other commodities. But with advent of Caritas and 4GATES, that issue is a foregone alternative. We don't longer talk of stockouts now. So we have our commodities intact. We have enough staff for all the facilities they support, and the work is ongoing successfully now.
In Delta, one of the strategies that was put in place was the flagship strategy. The strategy looked at identifying more men, more long-distance drivers, more adolescents, basically populations of persons who have been underserved and have been hard to reach. At the end of the day, over a 2-year period, we were able to identify over 1,000 persons through this strategy. Another strategy that we used was the community approach, where a community incident commander was heading teams
And these teams were diverse teams of persons drawn from the government, from the local government agency for the control of AIDS, from health workers in those communities who would have a hands-on knowledge of where to go, and of course, other members of staff. With this strategy, we were able to go after the numbers.
We go all out to identify those who have not known their status before now. Not only that, we ensure that these people are enrolled into care and treatment and continuation of treatment afterwards by giving them reminder calls to come for their appointments. Also making sure that when they come, they are taken through the process of counseling to ensure that they adhere to their medication, and ensuring that they are virally suppressed. That is to ensure that those drugs they take is actually working for them.
They encourage me in taking my medication seriously, especially on my son. We should be eating something proteinous and vegetable, all those things. Even so, they help me in giving me some food items, in supporting me in all ways, and also helping me in times of drugs, medical, taking drugs, and even be trying to build up our body system.
Caritas advise us to be eating what we building our system, and we make sure we stay in an environment that is clean, and make sure that we eat what is good in our body, and make sure that we keep ourselves neat and our environment neat. When I started admiring from that advice they gave us, I'm feeling stronger and healthy than other time.
Since I started taking my drugs, no symptom like coughing, no rashes on my body, no, maybe, for example, I see myself growing lean. No, I eat very well. I take enough fluid, I take my fruits, and I'm always strong. My husband's status is negative for 8 years now, and very strong. We all check it every year, and he's always happy and proud of me.
I was told if you're taking your drugs, you can transmit it. If you're suppressed, you can transmit to another person. So that was how my mindset began to change. And from there, I was enrolled into OVC. And from there, I started knowing more about Caritas. And I started meeting new people, new faces. I became open-minded and relaxed.
Honestly, words cannot say how I feel. Only God knows, because I feel I'm back to life again, and I feel I have hope.
We ensure that they do not miss their appointments. We ensure that they do not interrupt their treatment, and also ensure that if they take their lifelong antiretroviral treatment, they are virally suppressed, which is the long-term aim of taking those drugs.
Through our aggressive tracking, we still reach out to them in their various homes, either by couriering the drugs to them or visiting them at their homes or a nearby health facility that is closest to them. So these are some of the innovative things we did to make sure that they are retained on treatment.
Another effective strategy employed by Caritas Nigeria is a collaboration with laboratories, traditional birth attendants, and traditional healers.
We needed to also ensure that we saturate the entire state when it comes to HIV testing, and we were able to partner with about 400 laboratories, traditional birth attendants, and health facilities that were not supported by PEPFAR. And it's interesting to note that on a weekly basis, we were getting referrals as high as 60 cases newly identified that were being referred to supported health facilities. And that also contributed to the achievement that we had in the state. And then one other one we did, another innovation, was what we call the traditional healers strategy. We had as high as 15-20 cases that were referred to our health facilities from these places on a weekly basis.
Traditional healers in this side of the country too, people are seeing them like they are all and all. If one is sick, they start from them. They can only go to hospital if the traditional healers tell them that, this case is hospital case. So they see hospital as the end point, not the starting point. Initially, they will tell us that their fortune tellers, there is a way they will do it, and they will tell them that it is positive. Then I said, okay, I am not arguing that what we are doing is not real. But can I teach you how, if that's your charm, say that this person is positive, then you will use our own and confirm that what the charm is telling you is true. They accepted. Then I taught them how to do HIV testing using the first line test kit, which is a determined test kit. So if that one is positive, they can now call the community tester that is attached to them, because each herbalist working with us, we attach one community tester.
Ana me check spiritual no nwere ihe mkparora na kashakpa na kareka. Enwere manyi me mom ja fuzo me mtukuru mbom. Adina check me ozam no positive. Na edire ejekuru tochi. Na me test kendo ibu. No bu positive no boyo kambo. Before na tochi otenu ihe m ji akwa kam. As na ndo ibu na sanitizer. Na ihe m je yiche kam. Also no bu hand glove. This group
communities has also carried out some HIV community intervention, as well as providing ART services also within these communities, as well as the CBOs we engage within the same period. The reason why we had this group is just to also ensure there's some level of ownership and sustainability, in the state.
With these amazing strategies in place, Caritas Nigeria recorded huge successes over the 5 years of implementing the 4GATES project in Enugu, Delta, Imo, and Abia states.
After the NICE survey, we have been able to close that gap. We had a treatment gap of about 62,000 patients. Now we have about 70,000 patients on treatment. Secondly, it's also important for us to note that when we came in 2017 and took over Enugu State for the implementation of this program, our viral suppression was at 73%, but today our viral suppression is at 98%, and we have gone even beyond the 95% benchmark. In terms of our treatment gap today, it's important for us to note that we have been able to reduce that treatment gap for adult population to 0. Imagine having a treatment gap of about 62%, and we have been able to reduce that to 0.
Since 4GATES project started, Imo State has been doing well, and you can see that our 95 target to end the HIV epidemic surge or control. So you can see that in first 95 we are about 113%, and second 95 we are 98%, and third 95 we are also absolutely at that, and viral suppression we are about 97%. So you can see that Imo State is on top of their game.
Projects are pleasing 74,130 people who are living with HIV on life-saving ARVs. And not only that, we have partnered and worked with about 4 community-based organizations and 80 community testers, and of course working in 33 facilities here in Imo State, disaggregated into 19 secondary care facilities, and of course 14 primary health centers. So with the effort of the Caritas Nigeria Imo State team, with the stakeholders that we are working with, we have moved Imo State program from being a red state to a green state, because we have achieved epidemic control over these 5 years of programming here in Imo State.
When it comes to first 95, second 95, and third 95 growth, we've achieved close to 90 to 95% rate with Caritas. So it's a big one. Take, for example, when the program started in 2015, from 2015 to 2021, Caritas started October 21. We only screened and got 8,000 to 11,000 positives. But between 2021 October, when Caritas started, the last month, Caritas already has screened 42,000+ people.
We've been able to test over 5 million persons for HIV. We've helped them to know their status. And out of the 5 million that we tested, we're able to identify over 200,000 who were HIV positive. But our responsibility doesn't stop there. Out of the 200, we're able to at least link over 99% of them into ART care across our facilities and communities in the states where we operate.
So in terms of contributing to the total number of patients on treatment in Nigeria, Caritas Nigeria, through the 4GATES project, significantly contributed to that. Looking at the name of the project, to achieve epidemic control in subnational units, I think I would say that we essentially achieved the goal of the project in the 5 years. The project also significantly focused on Orphans and Vulnerable Children's program, where we were able to provide services to vulnerable children and households across the 4 states.
We trained 23 community-based organizations, built their capacity to deliver what we call comprehensive OVC services, cutting across health, psychosocial support, education, nutrition services, household economic strengthening, which is the fulcrum of our interventions to ensure that when we leave the communities, every enrolled household have at least a source of livelihood to be able to meet their needs across board.
Through this project, some households that we are struggling with every difficulty to feed, some of these households, we are supported by IGA, that is Internal Generating Avenues, trying to help them start up businesses that could help them sustain their families. We also provided some supplements that helped malnourished children to come back to life.
On the OVC project, we enrolled 14,093 beneficiaries from the 3 CBOs. So we're able to provide cash transfer to 307 women across the 3 senatorial districts. And for adolescents, because we also target adolescents who are between the age of 14 to 17 years. So they were enrolled in skill acquisitions. Some of them are into tailoring, welding, mechanic, carpentry, and even soap making.
The success story is that so many of them have graduated and we give them starters pack. The last visit we did, we discovered that those girls who could not have 1 naira, 10 naira, asking their mother for money for pad, especially the girls, can now support themselves, can now even support the household. That was a very remarkable achievement.
I saw life being touched. I saw people being able to access health care and being able to make aware of that HIV/AIDS is not the end.
My neighbor got my pikin pregnant. So after they take us to the hospital, they discover disease from my daughter. So they have been taking good care of her and her baby. Even the time my daughter deliver, so they take good care of her. They bring many help to her. They support me with a mineral of 40,000, and I have added to my business.
Mega za 15,000 naira. My first son, Chineke mnyebe nego anaishi n'ime ya weti secondary school. Shikwe n'ime ya na-echange ha kwa na-azụkwana ha na school. Na-enye ha nri ọnụ, ha na-eri nri ọnụ ọfụma.
Ka ha nyere m the 30,000 na ehojuru m. So suze balatazi be uzere ewu je mashwa ogana ganam. Anyị ga-eshi mbọ m enweta ihe anyị na-eri.
Lokacin da damuwar mai gidana ya fara last year baya samun albashi. Abin ya kawo damuwa domin ga ni dai ga ciki ga dai ba abin da zan yi kuma cikin ya zo min da damuwa. Abin da yana zuciya na kawai sha maganin mutu. Domin baya da kyau na tashi kowanne rana in duba kaina yarana ba su ci abinci ba, yarana ba su je makaranta ba. Abin bai zo min da sauki ba. Sun zo to my rescue. Sun taimake ni sun bani kasuwan da har zan ba yara na abinci. har zan biya musu kudin makaranta gaskiya ina ce musu na gode.
My two children are very, very healthy. They are HIV free. The only sickness I always see in them, maybe malaria, headache, and when I give them 1 or 2 tablets, it's off. Looking at them, they are healthy. And they have gone through the test all these years. There is no sign of it at all in them.
Even when my children are ill, they took us to the hospital, they paid the bills, and my children were treated. Even when there's nothing they have, they brought some food stuff to us, a lot of things, both oil, onions. They put my daughter where she can learn fashion and designing. And today they are giving him sewing machine.
They paid for my tailoring stuff. I learned tailoring and they bought the machine for me, and today I'm a good tailor. I can make both male and female dresses. I also want to thank Caritas for initiating this program called OTZ. It has been really helpful to many adolescents, many young people around my state. From OTZ, people understand that when they are HIV positive and taking their drugs very well, that they cannot transmit it to their partner, even if their partner is negative, and they cannot transmit it to their children.
When we started, we had barely 646 adolescents in this program, and their viral suppression rate was at 46%. As we're closing out 4GATES program, we have close to 8,000 adolescents in our program, and their viral suppression is at 91% as we speak.
Over the life of the program, that's 4GATES program in the 4 states that we worked in, that is Abia, Delta, Enugu, and Imo, we've been able to identify precisely 10,500 children and place them on life-saving antiretroviral therapy. And that has been really worth the while for the lives of those children.
Amazingly, CDC and Caritas Nigeria's efficient and sustainable interventions have yielded even greater results than they had envisioned.
We find that we're actually giving treatment to people from other states in our own facilities, because a lot of work was done at the border areas of Enugu State, between Enugu State and Kogi, Enugu State and Ebonyi. So the figures for treatment for HIV/AIDS in Enugu, suffice it to say that what I have observed is that the positive engagement with the Caritas and 4GATES project has flipped the reality.
COVID crept up on us, and all of a sudden there was a lockdown. We had to find ways of getting drugs to our patients, find ways to keep testing. So what we did was we trained individuals within their local communities so that at least they could still operate in their communities for testing and also for drug refills. We also got permits in the different states that enabled us to move around even during the lockdown as essential service workers so that we could carry that out. But most importantly, I think technology. It made us come to terms with the fact that remote working is possible. We were able to still stay efficient even during COVID. Our performance didn't drop significantly.
We worked with lots of religious leaders. We had trained over 7,000 religious leaders across the 6 states that the Messages of Hope was implemented to tell people that COVID-19, though it's very deadly, but it's not the end of the world, that people could still survive if they practice of religious leaders' behavior, which means people need to take preventive measures like washing their hands, social distancing, and a lot of religious leaders ran with that.
We also supported the state government in the areas of COVID-19 vaccination. We had to also create more awareness, and between January 2022 and September 2022, we were able to support the state to vaccinate over 800,000 people.
We are really so grateful for the support so far Caritas Nigeria has been given to the state, and also CDC, how they support. They have also the love and support they have shown to Imo State. That shows us that they really have us in their mind and their hearts. So we are really grateful.
Caritas and CDC need to be
largely applauded. They have done so well. They are there for the lives of the people. They are there to maintain good health, give people hope, reassure them, establish them, build their capacity, make them feel happy, make them feel like every other person.
On behalf of our Executive Governor, Dr. Lawrence Ifeanyi Ugwuanyi, and our own Honorable Commissioner, Princess Peace Nnaji. And in fact, on behalf of the people of Enugu State, we say a big thank you to CDC, thank you a lot, and to Caritas, we say a big thank you. The love they have shown was immense, and it goes a long way to help.
It's about partnership. It's about continually adjusting and positioning for better results. It's about planning, implementing, evaluating, and then planning again. Public sector, private sector, partnering together for best results. That is what is happening between, or what has happened with the partnership between the Enugu State government and the 4GATES project, with Caritas spearheading it in Enugu State. That's the kind of thing that we want to see continue, and we're sure that we will just keep moving closer and closer to the best results for healthcare delivery in our space.
Stakeholder engagement can never be overemphasized. Working with the government, working with the community structures, the gatekeepers and leaders, you need their buy-in. There has to be ownership. You can have a perfect program, but if there is no community ownership, then the chances of sustainability are very slim.
Part of what PEFA wants to see is to see that there is some level of ownership and sustainability, in the HIV response that they are funding. And based on the directive and the guidance, they'll be signing a tripartite arrangement between CDC, between the state government, and even the federal government. So these are key milestones that will be tracking and ensuring that we work closely with the state government, because all activities that will be doing preparation of work plan, tracking of indicators, various review meetings, will be working closely with the state government in ensuring that all this actually come to play before the end of the FY. So that's the ownership that we want to see. So that by the time we now begin to journey towards sustainability, they must have fully understood all what we've done previously and what we're currently doing, so they can take off from there.
Caritas have really done so much. And by the special grace of God, this landmark they have planted in the state of God will continue to blossom to a point that we can now say, yes, without IPs, we can actually ride on the success stories and make a great difference.
We are in the third cycle of a wonderful relationship with CDC. We've had the SUSTAIN project of 5 years, we've had the 4GATES project of 5 years, and we're into again another 5-year of access project. What a level of trust and confidence. We found this enriching because the collaboration has been very dynamic, and that has been a wonderful synergy of relationship that its outcome is evident among people of concern, people whom we are attending to in care and solicitude in the facilities, people who are unfortunately living with HIV, whom we have won from the pangs of death and seated them again into the palace of life through this wonderful assistance and support from CDC, American government, and its people. And we are to them eternally grateful.
This Caritas Nigeria, Caritas work on now I'm happy. Obi them so because of the Caritas. Makani obi jadunu mo so no na azofto mo mado. Na mada na ga na nguride na HIV.
I want to say big thank you to Caritas and CDCs for providing for food items and for medical treatment, and also for helping my son to be among the living. I want to thank them for being there for me, for standing for me when hopes are down. And
I'm saying to Caritas that I'm very, very happy the way they are supporting me and my family. To American government, the way they have taken care of me and my family, I'm very, very happy.
I want to say to Caritas that may God bless them, for them to remember us, to help us, to start a business for us, both medication, both in everything. May the good God bless them.
Nyam na agwa ha na Chineke na nye ha aka, nyere ha aka, mere ha ebele, nye ha ndụ, nye ha ogologo ndụ ahụsi ike. Na dịka ha si help guy, Chineke mee ka ebe ha si wepụta ya ka ọmụba mmaji pụrụ mmaji. Na agaghị ha the lack of that side again.
I want to say a very big thank you to Caritas Nigeria. Like, they have done a lot for me and my family. Like, so many youths all over the country, all over the world has benefited from it, and we are really grateful. We love you so much, Caritas.